So corneal ectasia is a condition of the cornea where you get an abnormal shape. And under corneal ectasia, there's several different types of conditions. There's keratoconus, there's keratoglobus, there's pellucid marginal degeneration, there's post-LASIK ectasia, and all of those conditions end up with an abnormal shaped cornea where you have irregular astigmatism. And the concern about that condition is it can be a progressive condition where it gets worse over time. And so there's two goals in treating corneal ectasia or keratoconus. The first goal is we want to stop progression. And then the second goal is we want to correct vision. So with stopping progression, the way we do that is we tell you to stop rubbing your eyes. And then there's a procedure that we do called corneal collagen cross-linking. And with that procedure, we put a vitamin on the eye, we put riboflavin, and it soaks into the cornea. And after a 20-minute soak, then we shine a UV light, and that reaction with the riboflavin and the UV light links the collagen fibers together to strengthen and stiffen that cornea so that it doesn't continue to progressively get weaker and weaker. It's a good procedure that stops the progression of corneal ectasia or keratoconus, but it doesn't make the vision better. All it does is stop it from getting any worse. So that's when we go into the second part of the treatment, is we want to make the vision better. And there's several different ways that we can make the vision better. There's glasses. That's the easiest, least invasive way of correcting vision. But sometimes with high levels of astigmatism that can be a result of the keratoconus, it can be difficult to correct the vision with glasses. Contact lenses are a great option. That'll correct all the vision, that'll correct the astigmatism, and you'll get really good quality of vision with the contact lens. But it requires you to be trained on how to put a contact lens in, how to take it out. You got to take care of it. Every morning you got to put it in, every night you got to take it out. You can't sleep in them. So it's really important to take good care of the contact lenses, and some people can't manage those two things. So if we can't correct your vision with glasses, and you can't tolerate contact lenses, then there can be some other procedures that are more invasive. One of those other procedures involves using a laser to create some channels or cut some channels in the cornea. And then we put some tissue in those channels to reshape that cornea. Now, it doesn't get you out of glasses and contacts, but it would probably make it so that you have a better fitting contact lens, or you get a better glasses prescription that can correct the vision more appropriately. That procedure is a newer procedure called ALK-RS, or anterior lamellar keratoplasty with regional segments. And then the other way, if you look at keratoconus, that we can treat it surgically is with a cornea transplant. It's more invasive, and we usually don't do that until there's scarring in the cornea, or where there's no way to correct the vision with glasses or contacts, and these other procedures won't work. We have to clear the we have to clear the visual axis and get rid of that scarring, and we can do that with a cornea transplant. So essentially for that, we take a cookie cutter that's a perfect circle and trephinate that cornea and cut a perfect circle. We do the same thing to some donor cadaver tissue, and then we put the two together and sew it into place. And that will clear that visual axis so that we can get better vision.